Welcome back to Bella Society. Now, a research was done, National Cancer Registry in 2007. It says that lymphoma is the 6th most common cancer among Malaysians, and among men it's the 6th most common cancer, and among women it's the 8th most common cancer. And if you didn't already know, I mean, this is a worldwide research that 1,000 patients worldwide is diagnosed every day with this particular type of cancer. Now, to tell us a little bit more and to tell us what it's all about, we have got here with us Dr. Dalila Kamarudin, who is the head of Cancer and Health Screening Clinic at the National Cancer Society of Malaysia. Good morning, Doctor. Welcome to the show.
Welcome. Thank you very much. Good morning.
Good morning. So, before we begin, can you just give us an overview of what lymphoma cancer is all about?
Okay, lymphoma is basically the cancer of our lymphatic system. So, I mean, it's kind of, you find it's kind of what is lymphatic system.
Yes.
So, lymphatic system, basically, it is a system which consists of the lymphocytes, which are one of our immune body system. And what does the lymphatic system consist of are all those systems plus with lymph nodes. So, the main thing or the main function of this lymphatic system is to remove any excess fluid from our body, and also to sieve all the toxics, and it's also as a part of our immunity system. So when we say that we have a lymphoma, meaning that the lymphocyte, which is in the lymphatic system or vessel, has cells multiplying and dividing and becoming cancerous to all those lymph nodes. But the lymphoma can also occur in some of the lymphatic system organs, which includes our spleen, our chest, abdomen, and our groin.
Groin area.
Yes.
Okay, so that from a layperson's point of view, basically, when we hear about lymphoma, you know, the most immediate thing that comes to my mind is lymph nodes.
Yes.
Now, where are these lymph nodes located? And you know, where women are concerned, and I'm sure a lot of women out there concur with me, we go for facials and we do these massages for lymphatic drainage and all that kind of stuff. So that's my knowledge of lymphoma or lymph nodes. So where are they and what do they actually do? Okay,
basically our lymph nodes are all over our body, but the main area is our necks.
Yes, because that's where people the masseuse concentrates on.
Especially when you have an infection or a fever, your lymph nodes will be swollen.
That's right. You know, every time I get a fever or something or a virus, you know, and then you have like nodes like, you know, it's a bit bengkak, right?
Yes, swelling. But it's when the lymph nodes are not, it's not absolutely, I mean, it's still swollen after a few weeks, then you will suspect of something else. So the lymph nodes are especially at our neck.
So why do they swell?
They swell is because there is an interaction of the lymphocytes towards the infection that is coming to our body. So it enlarges. It goes into a process of inflammation, so it enlarges.
So what's the purpose of these lymph nodes actually?
It's supposed to remove all those toxins and circulate back to our body so that it goes back to a toxin and it removes all this excess.
So when it gets blocked or clogged, that is when we have to be alarmed. So basically, it has to be clear all the time.
Yes. So
drained, basically.
Drained. Basically, as I mentioned just now, the most common places are the neck, the armpit. All right, then you have also at our chest area, and then you also have around our abdominal area, and also our groin.
Okay. So after a few weeks, if let's say these nodes don't subside, the swelling doesn't subside, that's when we have to
you have to think of differential diagnosis that could lead to something else. So one of the things that you could think
when you talk about the swelling, is it very big or very small? Because people out there will probably be touching their necks right now, and they'll probably be going, yeah, I feel a little bit, but I don't know if it is or if it isn't, you know?
Usually when it is a little bit enlarged than normal. You know, when you have a fever or when you have a tonsil or even you have any infections, you do feel a little bit enlarged. But it's when it's enlarged to a certain size that you know it is not normal for you. Then you must have a precaution and be cautious about it and go and see a doctor regarding it.
Okay, so I understand also that this lymphoma cancer affects more men than women. Why is that?
If you were to ask me, there is no exact cause why. It's just also the same thing why it is certain cancers are more common in females, for example, breast or cervical. But of course, it is more common in the males rather than the females. No, the exact cause we do not know why. It's just
is it because men have more testosterone, or is it something to do with that? Because I was talking to Lena earlier, and she said that, you know, the little percentage of women who have it are a lot more active. They're adventurous. They climb mountains. You know, they do a lot of very sporty stuff and all that kind of thing. So has it got? Is there a correlation there?
So far, from what I know, from what I read, there is no. I mean, there is no studies done yet. Is it related to hormone testosterone? But we do know some of the risk factors that causes lymphoma is basically those who have a lower immunity system, meaning that they have all those HIVs, you know, they are more prone, or those who have an autoimmune diseases, for example, they are more prone to it. Now, looking at that statistics, then we will think that HIV is more common in males, for example. And also, like a certain virus also triggers this lymphoma, for example, Epstein-Barr virus. So looking at those risk factors, I think it is more common in males. I mean, if you were to ask me why, I cannot say straightforwardly why it is more in males.
Okay. But it's predominantly in the males.
Yes.
Now, where Malaysia is concerned, what's our rate now where, you know, lymphoma cancer is concerned? Are you getting a lot more patients having it these days in comparison to before?
I guess if you're talking about lymphoma in general, why we're having more cases nowadays is because there are a little bit more awareness about it, and there's also people coming forward to the screenings, especially when, you know, we have an educated people around, I mean, Malaysians that also do know a little bit of this lymphoma. So the raise in incidence could also be because of there's a little bit raise of awareness, and because there's a little bit of screening that is available. I mean, not the basic screening like mammogram or cervical, but we know we can do something to diagnose it earlier.
Okay. So in terms of contributing factor to this cancer and what causes it, you say mainly if your immune system is low.
Low, yeah, especially those who has, for example, those who has HIV, those who has an autoimmune diseases, for example, SLE, also those who are, triggers to certain types of viruses, and it also do play a role a little bit on genetic, especially if you have a twin or a sibling who has a lymphoma, then your risk is slightly higher than the other.
Higher risk.
Yes.
Okay, fantastic. Now we're going to go for a short break, but please stay with us. And when we come back, we're going to be talking to a lymphoma cancer survivor. So for those of you out there who have been diagnosed with it or anything, here is your inspiration for hope and support. Stay with us. Welcome back to Bella Society with me, Elaine Daly. We're talking about lymphoma cancer. We got a little bit of a 101 about what it's all about with the doctor earlier on, what causes it, what it is actually, and where your lymph nodes are. I'm sure a lot of you not sure even what lymph nodes are. But now we have with us a lymphoma cancer survivor. And here's your story for hope and support for all of you out there. So I'd like to say a very good morning to Lena Abdullah, who is the president of Pink Unity Support Group and also a lymphoma cancer survivor. Good morning, Lena. Welcome to the show.
Good morning.
You're looking great.
Thank you.
I was just complimenting you in your shirt and the buttons earlier.
Thank you.
Very cool. Anyway, thank you for coming to the show to share with us your story. Lymphoma cancer, as we heard from Dr. Dalila earlier on, it affects the lymph nodes, and you were the one who was saying, you know that it affects more women than men, and more active women.
Yes.
Now, how, when, and what was your reaction when you were told that you were diagnosed with lymphoma cancer?
Okay, first of all, I don't even know what is lymphoma.
How many years ago was this?
It's going to be 6 years by July.
Since your last chemotherapy?
Yes, 6
so
years.
Before that, you...
Very active life. And when the doctor told me, I had a growth in my leg, not in my lymph node. So lymphoma sometimes...
Where in your leg?
In my upper thighs.
Okay.
So lymphoma, it's divided into a few categories. So mine is called a non-Hodgkin lymphoma.
What does that mean?
Non-Hodgkin lymphoma, it's an aggressive type. it grows very fast.
Oh.
While Hodgkin lymphoma, it's a slow lymphoma. So by the time you know, sometime you'll be in the stage 3 or 4.
Sure.
Yeah, but non-Hodgkin, it's very fast. So definitely you will know before you reach to that stage. So when the doctor told me...
So your swelling in your thigh,
swelling.
was it really big, or
It's
was
not
it
really
just...
so, it's a growth. It's big.
So you could feel like
could feel
bump.
Yeah, the bump. It feels like a small little limau, lime.
Okay.
Yes, and it's painless, and it's growing rapidly. And I went to the doctor and removed it. And after 5 days, doctor called me and said, "Okay, I got some news to tell you. This is you need further treatment." So I was wondering, what kind of treatment?
Okay.
Chemo. He said, "Oh." And first of all, I don't know the word, what cancer it is.
Sure.
Because you know you won't read this kind of thing if it doesn't hit you.
more often than not, we
Yes,
hear
yeah.
about the more common ones. You know,
And then I know
cervical,
what
breast.
is lymphoma,
Okay.
and then I got to know what it's all about. And usually, like me, lymphoma patient, we have been treated not by oncologists but by hematologists.
Okay.
Okay, lymphoma, it's also fall under category of blood cancer.
I see.
Yes, blood cancer. So the same doctor, hematology, who treat leukemia, will treat me instead of oncology, who treat breast cancer and the rest.
And you know, what was your reaction when you were first told about this by the doctor?
Shock.
Were you
sad.
wondering before you even went to have it removed? Did you even wonder like what
I
was
know it was a
about?
growth, but I didn't think about it as
You
a
didn't
cancer.
think it was cancerous?
Because it's painless, and I didn't know nothing about cancer. I thought cancer means you're very thin and skinny and then dying. Actually,
Okay.
it's not. You are very active. I go to gym. I have my own instructor to teach me, and so it didn't click in me that growth it's cancerous.
Sure.
Yeah.
And your reaction and I mean, you know, it's a terrible
Yeah.
piece of news to have. What did you do?
I was very sad and scared, of course. Scared and sad because not knowing is the worst thing because you don't know. And of course, you keep on questioning.
Why me?
Why? Yeah.
Yeah, that's what a lot of people ask.
Why me?
But you were very strong in wanting to go and seek treatment and, you know, finding more about it instead of just wilting at home, right?
You wouldn't believe me. It took me 4 days to decide to do. 4 days. Doctor told me on Thursday, Friday, one more day to go and ask another doctor, Saturday another doctor. Monday was public holiday and I did remove it on Monday.
And what did your family say? Or what was their reaction?
I think they're more shocked and scared than me. So I have to be very strong because that
Where
time...
did you find your strength from?
I don't know, looking after 3 boys, I think. Having sons make me more stronger, I think. So 3 boys and a girl, and I want to be for them. You see.
Yeah, because
I
I'm
want to
sure
live.
you've come across, and you know, especially moments like these, you know, it's very difficult for anyone to find strength, be it a man or a woman, you know, and to say, okay, after 4 days, I'm going to go and get treatment and do something about it and fight this. Is a very big feat.
Yes, of course.
So,
The
you know,
fear.
a lot of people out there probably think, you know, like, okay, that's it. My life's over. I'm just going to sit down here and just do nothing and wait for, you know, for the worst to come. But you took it in your hands.
In my heart, I do feel
something.
my life is over in that period until the chemo because you don't know what to expect.
Sure,
You see,
sure.
But I just want to go through it.
So you went through chemo, and were
Yes.
you diagnosed with, was it an early stage?
Early stage,
or?
yes. Early stage, but okay, again, non-Hodgkin lymphoma have a few categories. Mine is fall under diffuse large B cell, again, aggressive one. So you
Okay.
can't wait. You have
So
to
you
do
need
it.
to nip
yes,
it in the...
you can't wait, yeah, because it
Okay.
grows. So it's one category, another category, another category, you see. So you can't wait. If you wait longer, then you're risking your life.
Right,
Yeah.
right. So what was it like going through chemo and all that? And did you, you know, were you told back then, you know, the causes of this particular cancer?
Yeah, but you didn't expect it was going to be more and more and more because cancer is one disease actually you can't predict what is the cause.
Yes.
Because you don't know what's your body's reaction after the treatment or while doing the treatment.
Is it hereditary? Did your family members, did they have it too?
No, you see, but I was searching and searching what the cause of it. And well, if you keep on searching, you can't. I was thinking maybe some of my uncle who died when the age of 9 and 10, they could have been leukemia.
Probably.
It could have been, you see, yeah.
So it's relatable, leukemia and lymphoma cancer?
Because blood cancer.
Ah.
Yeah, leukemia is blood cancer, lymphoma is also part of blood cancer. It's
okay, so when you did your chemo and you finished it and so now you are free and clear?
Yeah, clear, yes, clear.
You say clear, you won't say cured?
No, we won't say the word cured.
Why not?
We say clear because once you have cancer, we can't say 100% you are cured of cancer, because sometimes you can't kill the 100% of cancer cell, you see. It's just that you have to change your lifestyle. Yeah.
Okay.
You still have 15% of risk coming back.
And how different is your lifestyle then and now?
I'm a better person now. I appreciate things now better.
Sure, I mean, but lifestyle-wise, are you still as active?
Yes, yes,
and
I do.
you? But are you very conscious and aware about what you eat and
that one
what
also,
you do?
yes. You have to be a bit careful not to eat a lot of the unnecessary, which is not good for your body.
Okay, okay. Yeah. So, what would you say then to people out there, ladies out there who have it? And you say it's so few, right?
Yeah,
it's so
3%
few.
like that.
It's the others that you've met. It's curable. I mean, are they clear of it too, or are they undergoing chemo?
Yes, they're undergoing. One still doing the chemo. The other 4 or 3 are cleared of it. Yeah.
So in Malaysia, as far as you're concerned, there's only about
a few.
4.
No, in my group, in our support group, we have only 5 out of 300.
Okay.
Only 5. Yeah.
So what happens in this support group?
Okay. You see, support group, they feel they can talk to somebody who know, because they went through the same thing. You can talk to anyone, but the person, really, it doesn't click. When you say, oh, I'm a cancer survivor, oh, I'm also a cancer survivor, and somehow you feel secured and you feel you can talk. And we help each other. We give them, we like a sisters.
Sure.
Yeah.
So someone who you can just, say, hey, today I'm feeling terrible, help perk me up, that kind of thing.
And when you see person around you, all are survivors and walking around happily, it gives you positive energy.
It's inspiring,
yes,
right?
Yeah.
Okay, so now with the fact that you're clear, do you always have it in the back of your mind? I mean, how does it work, mentally? Because your mental health plays a very important part in it, right? How does it help you to say, okay, now that I'm clear of it, I need to live my life to the fullest and do whatever it takes? Or are you living every day thinking, it's going to come back, or it might come back? What do I do?
I do think both sides. I always think also that, I must be prepared if it come back. There's always a chance, you see. So I won't forget that. I always say, I have to make myself better, because you never know, you see. And on the other hand, of course, live to the fullest.
Sure, sure. Okay, so you have a list of things that you want to do, and you've fulfilled it?
Yes,
for example?
I go again mountain climbing recently with my friends in the mountain, volcano mountain.
Where?
In Jogja. Yeah.
Very cool.
Yes, and forgive a lot of people.
Yeah, because it's a time for you to reflect as well, isn't it? Okay,
and take life easy.
Sure. So how often does your support group meet and all that? Because I'm sure a lot of people out there, whether or not they're lymphoma cancer survivors or suffering from it right now, there are other types of cancer they may be going through. So they probably want to know about the support groups.
They can come. They can call National Cancer Society. We have our girls daily from 10 o'clock to 1 o'clock to be there at the help desk to help them. And every month we have event for them. We have classes for them.
Sure.
Yeah, cooking classes, makeup classes, art classes, So most of them are housewife, or some of them still working, and they come. They come and join, and they see 20 ladies in the room with all survivors. It makes their day. Yeah.
And do you have a lot of, people in the group and all that who are overly emotional and they
Yes.
can't handle such
Yeah.
things? And what happens then?
This is the usually the person newly diagnosed with cancer.
Okay.
We have our own counselor,
Right.
and the counselor will talk to them. That
Because I
is
suppose
normal.
mentally is the
That
hardest
is
thing,
really, really normal, no matter how strong you are. And the first time when somebody and doctor say you got cancer, of course it hit you, just not hit normal, it hit you hard because you don't know.
Yes.
Yeah.
And especially when a lot of people say, oh, you have to really take care, don't get cancer because, you don't want to go through chemotherapy. It's the hardest thing ever. But you survived through it all. I'm sure it was a very tedious process, right, chemo?
Yeah. No, not really. It depends on each body.
Oh, really?
Because I was thinking of what other people
You're
thinking.
very
chemo.
positive. That's
I
fantastic.
was waiting, people say chemo is bad. Chemo, I was waiting. Okay, first chemo, it's okay. Second chemo is okay. My husband said maybe the third chemo. So actually, we were thinking of what other people saying about chemo. I waited until the sixth chemo. No, just tired.
Tired, okay.
No pain.
Speaking about chemo and treatments, we'll talk about this more because we're going to go for a short break, and when we come back, we're going to bring Doctor back on and find out what treatments are available for you out there. Stay with us. Some words of wisdom out there for you, and today we're talking about lymphoma cancer here on Bella Society. We've spoken to a doctor to find out what it's about. We've spoken to a cancer survivor, a lymphoma cancer survivor herself, and now we've got both of them back on set to talk about the treatments available and the procedures involved. So welcome back to the show, Dr. Dalila. And of course, we've got Lina here, who is a survivor of lymphoma cancer. Now, when we talk about treatments, what are the treatments available out there when someone is diagnosed with lymphoma cancer?
Lymphoma, as Puan Lina mentioned just now, is a little bit intrigued. I mean, it's a little bit peculiar in the sense that the treatments caters to the individuals. First, we need to know what types of lymphoma you are, either Hodgkin disease or non-Hodgkin lymphoma, for example. And then you need to know how much lymph nodes are involved, where it has spread, and so forth. And also depending on the pathological tissues that you have.
So does it mean that someone who's been diagnosed would have to go through many tests? It just sounds like it, you know?
Yeah, in a way, basically the first thing that you do is you do a biopsy. Next, you need to know where is the lymph nodes that is involved. Then based on that, we need to cater the chemotherapy that is for the special persons. So chemos, you have many regimes, for example, the basic regimes, and then you need to know whether does this patient has the ability to withhold this type of chemo. It's some sort like a try and trial, but then we know a certain type of regime which is possible for certain category.
Okay.
And as mentioned just now, also lymphoma has so many subtypes, and it's so confusing even for us. If you know there are so many trials that is being done also all over the world to see which suits the best for each person.
Okay.
So basically, you do a chemotherapy based on the regime, depending on the staging of those patients, either stage 1, 2, or 4. And then you go through cycles, either 6 cycles for the next every 2 weeks or every week, and then you see how they respond. Once you have done the first set of chemotherapy, you need to do some blood tests, especially to check for their livers, their white cells counts, to see either they are compatible. Then next, you do a CT scan, for example, to see where it has spread to the other parts of their body, PET scan, MRIs, and so forth. Next, then you go back to the next set of cycles. So it all depends on the individuals. Besides that,
You mean how severe,
severe
it is?
and how is the
Okay.
response of
Sure.
the patient. Then you might also combine it with a little bit of radiotherapy, but which mostly we try to combine with chemo and radiotherapy. Then if it doesn't work, then we have to go to the more of the extreme, which is either you do stem cells transplant, or you do, for example, a monoclonal antibodies where you go directly to the DNA of that patient. So it's a lot of work.
Yes, it sounds very tedious, actually.
It's not as a direct as for breast cancer or
Yes.
cervical. So it's challenging for the doctors to know what is the right treatment for
Because I suppose with cervical or breast, it's
Yeah.
at one spot,
you remove it.
right? And
Yeah.
but this is
All
in
of
conjunction with blood and your lymph nodes, and it's all over the body. Okay. Now, Lena, what was your procedure of your treatment like? I mean, you just went for 6 chemos. Was it very difficult for you doing the treatment?
Not really. And I had chemo and no radiotherapy.
Why is that?
Because the doctor said my chemo is very strong. You no need to do radiotherapy. And before that, of course, the scary part one, they need to drill my back to take the marrow. You see, that was actually it's a simple procedure.
They had to drill your back to take the
marrow,
the
to
fluid
extract
out from
marrow,
the marrow.
yes.
Why is that?
to check whether we need a marrow transplant or
Oh, wow.
anything. That was a scary part, but actually, frankly speaking, that was the most fun because
Fun.
I like how you put things.
Because
Shaving
you-
off your
yeah.
head was fun. Drilling your bone marrow
when you
was
say
fun.
drill, of course, it scared me. I was thinking
Yes,
like
I've got
somebody
goosebumps.
drilling from. I was so scared, but actually, it's a tiny, tiny needle. But of course, you need a special doctor, another specialist, to extract that 2 tiny needles to extract from your spine.
Because you really need to know where is
Yes,
this,
yeah.
where is the positioning to put in the needle, and then
Sure.
you have to wait for the liquid to come out,
Yes.
dripping slowly, right?
I see. Okay, so you had
I
to
did
go
that.
through
Yes,
that procedure as well.
Yes, and after that, okay, everything okay. So I just continue with chemo. Yeah.
Was it painful?
See, I was thinking chemo is painful.
That's what I hear.
No, it's not. It's like syrup merah, syrup limau putting in your hand. You know, I was thinking some kind of toxic. It is a toxic, but you don't know what to expect. But again, it depends on individual. Okay, and of course, there's a mild side effect. Say, maybe some people feel vomiting, which now they give anti-vomiting
Anti-vomiting,
tablet
yes.
before, but. Frankly speaking, no pain, just tired. Which
But
people,
when
yeah.
you have all the needles going in you
No.
and stuff, you know, that's where people say it's so painful.
No,
and all
because
that.
the first chemo, of course, they'll give through your the hand, and nowadays they give through a chemo pot. You
Oh,
do
yes,
a
that's
surgery
right.
to put chemo pot, and I don't know. Some people say pain, but to me, there's no pain. Tiredness is a correct word. You feel very tired.
Fatigue and
Yes, you
lethargy.
feel very tired.
Basically, why she feels tired is because all your immunity system are down.
Yes,
So
tired.
you feel tired. So
Tired.
that's the most common.
Are you able to eat and
Oh my God! I was on prednisolone. I gained a ton. It depends
Really?
from breast cancer and lymphoma. Lymphoma usually prednisolone will make you gain weight.
what's
Yeah.
prednisolone?
It's a
Steroid.
It's a steroid.
Okay.
It's a lot. It's a lot. And the tiredness, as I said, it's like even if you bathe, you need to use chair. You have to sit and have a bath, a shower.
And you sleep well and
Yeah,
stuff?
sometimes you can't. A certain day you sleep very well. Certain day you can't sleep.
Okay.
Yeah.
That is why it's very important for support from the family, because they might be
Yes.
thinking that she's taking advantage of her conditions
Yes.
to be lazy.
Do you get that from many patients, family members? Like, you know,
Yes.
they're like, oh, I'm so tired of taking
We tell them
care.
it's very tired.
We need to educate them because we need to explain that this is the process that is going through, so you need to be ready for what are the consequences. The best, I think, the best consultation is that before you start any treatment, you need to discuss what's going
Yes.
to happen with the family and also the patient especially, because we have seen that there are also frustration not only on the patient side but also on the caregivers, because they do not know,
They don't know, yes.
they do not know how to make them feel better. They do not know how to ease their pains and all those symptoms that they had.
So how were your sons or your kids' reaction towards this, and what did they do to ease mama's pain?
But now you see they have this internet, they know, so they learn, they say, oh, mama's tired. So, okay, they understand. The tiredness I can't explain. It's like after you bathe with towel and you want to put a baju, you take you half an hour.
Are you serious?
Yes.
So your whole motor system is
you just
slowed
slide down like that. You just slide down. You just tired. Certain day, oh, you had the energy like nobody else. Yeah.
Sounds a bit like pregnancy. Certain days you're so exhausted.
Yes.
And some days when you've got like so much energy.
Yeah. But not every day you're tired. Maybe 2-3 days and then you're okay again, and then you're tired and okay again.
Okay.
That's why we tell them they need rest.
I see, I see.
They need
so
rest.
when you talk about having 6 chemotherapy treatments, are you talking about having one every couple of weeks or so?
Mine was every 3 weeks. Depends. Some people every 2 weeks.
Every 2
Again,
weeks.
it depends on the body and the type of the lymphoma.
But one thing you have to understand, so while giving chemo, you have to also to look at the patient's perspective of do they have any underlying diseases. For example, it could lead into heart diseases as well.
Yes.
And radiation, you have to think about the exposure. So I would say that we are trying to be overall to cure the patient, but sometimes it could lead to some other diseases. So those with lymphomas, their risk factors of having another cancers or another leukemia is a little bit higher than the others.
Okay, okay. And based on what you've seen and based on your experience and all that, the fact of this cancer coming back for those who've had the remission or are cleared of it, in the men especially because it's more predominant in the men, how often do you see a comeback?
You're talking about recurrence and remissions. There's 2 different things, remissions and recurrence. So basically, it's having it back again. Now, it all depends again on the person's body and also the person's, how shall I say, their lifestyles after they have completed all their chemos.
Okay.
Some will say that they have another life again and they go more into alcohol, more into more into smoking, because it's just like anti-distress. But we always advise them to have a good healthy diet, reduce your smoking, reduce your alcohol, have a good healthy lifestyles. Reduce stress, for example.
You've been given a second chance. Don't waste it, right?
Yeah, but not all people as positive as Puan Lina. Some will say that this is my time again to enjoy what it lasts, so they do the extreme.
Like climb volcanic mountains.
Yeah.
Bucket list,
Yeah, your bucket list. And there any advice to our audience out there, for those of them who have family members or them themselves are, going through chemo or going through cancer? What would you say to them?
Okay, lives go on, actually, and for actually, you know your own body. For the person out there who doesn't know anything, what is lymphoma, there is will be a symptom. Your body will give you a sign and symptom that something is brewing inside. Like for lymphoma, actually, sweating. You sweat a lot. You see, day and night, even in the sleeping, you sweat. And sometimes women take this for granted. They think, oh, maybe menopause.
Yes.
Maybe the weather is hot.
Okay.
But actually, there is one of the symptoms, sweating. So, and then any growth, any sweating, don't wait. Go and see a doctor. If you keep on sweating non-stop, something is wrong.
Okay.
They say you must go and see a doctor and go for a check.
Fever, especially fever. We tend to take lightly of fevers.
Yeah, because we just pop in the
the
paracetamols and we think that it's going to cure everything. But if it persists, right, doctor, to go and seek professional help.
Yes.
Well, thank you very much, ladies, for coming down and sharing all this with us. I mean, it's really made us aware, opened my eyes, and I'm sure the audience eyes up a lot more. And thank you for the very positive vibe that you've brought on set today. Thank you very much. We're going to go for one last break, and when we come back, some Bella updates for you. Stay with us.